Taylor. I'm going to be your nurse today. I'm going to go ahead and close your curtain for some privacy.
Okay.
We're going to do your head to toe assessment today. They have already completed your vitals and everything looks okay. So I'm going to go ahead and wash my hands. I've already gathered my supplies so we can get everything going. Can you state your name and date of birth for me?
My name is Brianne Morrison and my birthday is January 15th, 1993.
Perfect. And do you know where you are today?
Dr. Dean's office,
And
May 31st, 2016.
Perfect. Okay. My client is alert and oriented times 3. Her clothing is appropriate for the situation. She has good hygiene. Her hair is neat and tidy. So I'm going to go ahead and get started with your head today. Any lumps or bumps? No. Good. Any tenderness?
No.
Good. Her hair is nice and clean. So we'll go ahead and move on to your eyes.
Okay.
I'm going to go ahead and begin to your pupils. You can just look at me. Good. One more time. And other side. Good. Your pupils go from about a size 4 to a 3. So we'll go ahead and assess your peripheral vision. Tell me if you can see my fingers.
Yes.
Can you see them?
Yes.
And can you see them? Yes. Perfect. All right. Now I'll have you follow the tip of my pen.
Okay.
Just try not to move your head for me.
Okay.
Ready? Perfect. Very good. And go ahead and tilt your head back, and I'll look into your nose. Good. Nerves are clear. No deviated septum. And we'll go ahead and do a little sniff test. Check your patency.
Okay.
Put one finger over your nose. Breathe in and out. And then the other side. Perfect. And go ahead and open your mouth for me. And then can you say ah? Good. Uvula is midline. Tonsils were pink, no white discoloration. And go ahead and do a swallow test for me. Go ahead and look up and swallow. Good. Any difficulty?
No.
Perfect. I'm going to go ahead and look into your ears. Good. Client has clear ears, normal earwax. Very good. I'm going to come behind you, and if you could just tell me what side I move my fingers on.
Okay. My right side.
Mm-hmm.
My left side.
Perfect. I'm going to come back around to the front. I forgot to state that the client's eyes were accommodating and her scleras are white, no noticeable discharge. She didn't have any vision impairment. So I'm going to go ahead and palpate your sinuses. Let me know if there's any tenderness. Any tenderness?
No.
Good. Go ahead and go to your lymph nodes. Submental, submandibular, pre-auricular, post-auricular, occipital, tonsilary. Go down to the cervical chain, to the posterior and anterior. If you can shrug your shoulders a little bit. And supraclavicular. Good. No noticeable lumps, bumps. Lymph nodes weren't swelling. Any tenderness?
No.
Good. All right. So now that we're finished with that, I'm going to come around your backside.
Okay.
And I'm just going to measure your anterior to posterior transverse diameters. And they are equal bilateral. So I'm going to go ahead and listen to your one since I'm back here.
Okay.
All right. And if you could just lift up your shirt a little bit for me. I'm going to listen to 6 different places. And if you could just take a deep breath for me. Good. Perfect. And then before I make my way to the front, since I'm back here, if you can go ahead and take a deep breath for me. Perfect. Her thoracic excursion is equal and bilateral, no use of accessory muscles. I'm going to come around to the front. And if you could lift your arms up and cross them for me. Good. We'll listen to 2 more on both sides. Deep breath. Good. Perfect. You're not getting dizzy, are you?
No.
Okay. And then 6 more.
Okay.
Down front. And lift up your shirt. Good. I'm listening to your lungs. We're going to move on to your heart.
Okay.
Alright, so this is going to be the aortic, which is the second intercostal space, right of the sternal border. We'll go over to the pulmonic, which is the second intercostal space, left of the sternal border. And then we'll go up to Erb's point, which is left of the sternal border, third intercostal space. And down to the tricuspid, which is in the fourth intercostal space, left of the sternal border. And mitral, which is the fifth intercostal space, midclavicular. Good. Heart rate sounds even, no, not thready or weak, no whooshing, heart rhythm sound bounding. Okay, now I'm going to go ahead and feel your carotid pulses. Good, they feel bounding, both bilateral, not thready. We're going to go ahead and come down to the brachial. Good, and radial. Good, both are strong, even pulses. We'll come down to your ankles, to the posterior tibialis. Good, and to the front to your dorsalis pedis. Good, and since I'm down here, I'm going to go ahead and feel your extremities.
Okay.
No edema or swelling, any tenderness?
No.
Good. I'll come up to your arms. Good, no swelling, no redness. And I'll go ahead and look at your fingers for capillary refill. Good, 2 to 3 seconds. No delayed reaction to the capillary refill. Toes. Good. So now we'll go ahead and move on to your abdominal assessment. Can I help you get into a comfortable position?
Sure.
Alright, I'm going to come over here to the other side.
Okay.
And if you could just lift your shirt up for me a little bit. Good. Alright, client has no noticeable birthmarks, no tattoos, no piercings. Skin looks clear, no discoloration. So I'll go ahead and listen to your abdomen.
Okay.
Starting in the lower right quadrant. Good. Vowel sounds are 5 to 20 seconds per minute. I'm going to go ahead and feel around on your abdomen.
Okay.
Just let me know if there's any tenderness.
Okay.
There's no lumps, abnormal bumps, masses. Have you had any difficulty urinating?
No.
Good. And what about your last bowel movement?
Today.
Perfect. And go ahead for cups. Good. Alright, go ahead and lay your shirt down. And then if you can go ahead and sit back up for me. Good. And then if you could bend over for me, just lean forward. I'm going to take a look at your spine, make sure everything's aligned. Spine looks in good shape, no scoliosis or abnormal formations. Perfect. So I'm going to come around the front. And if you could just hop up for me, we're going to get your blood flowing, do a little bit of exercise. Go ahead and put your arms out for me. We're going to rotate. Good. And you can move your arms up. And we're going to go down to your back. Good. And you can go side to side. And make sure your shoulders working. Good. And then we're going to go out with your hips. Both sides. Good. And you can wiggle your ankles for me. Any pain in any of your joints?
Nope.
Good. And then if you could just take a little walk for me to the chair and then come back. Her gait is steady. No impairments. Doesn't need any aids to walk. And then one more thing, go ahead and hold your arms out for me. And tilt your head back a little bit and close your eyes. Client has minimal swing. Balance is good. Everything looks good. Okay, my dear. You can just hop back up on the table for me. Are you in a comfortable position?
Yes.
Alright, so we're just going to check your strength. If you can put your arms up for me. And I'm going to pull against you, resist me. And then we're going to push against you. Good. I'm going to come down to your legs. Pull back for me. Good. And push up. Good. And we're also going to do your feet.
Okay.
Push down to me. Good. And up. Awesome. No delayment in muscle movement. She's very strong. And so we'll go ahead and do your reflexes.
Okay.
Alright, you can put your arm up for me and relax. Alright, so I'm going to check her tricep reflex. I'll do it one more time. Perfect. And put your arm over for me. Relax. I'm going to check her bicep reflex. Perfect. I'm going to turn over just a little bit and we're going to do her brachial reflex. Awesome. And come over to the other side. You're going to do the same thing on this side. Just relax for me. Tricep. Good. And we'll do the bicep again. Good. And brachioradialis. Good. I'm going to do your patellar.
Okay.
Good. Come over to the other side. Good. And then if you can lift up one of your legs for me, we're going to do your plantar reflexes. Good. And do the other side. No flexion in the toes. Awesome. Okay. All your reflexes were 2+, no delayed movements or hyperactive reflexes. Are you comfortable? Do you need anything else?
Nope, I'm good. Thank you.
I'm just going to open the curtain and wash my hands. I'm just going to finish up some charting, so if you need me, just give me a call.
Okay, great. Thanks.
Hallelujah.
Yay!